the pre-survey that is in the chat. The group is the Black Greek Letter Consortium. Once again, good evening. Thank you for joining us. We'll be getting started shortly. Once again, good evening. Thank you for joining us. We'll be getting started in the next minute. We're just asking that you please take the pre-survey that is in the chat. Thank you so much. Once again, thank you for joining. If you could please take the pre-survey that is in the chat. All right, good evening. My name is Dr. Siobhan Chambers Williams, and I have the privilege of serving as the co-director of the All of Us Research Program for Zeta Phi Beta Sorority Incorporated. And tonight, we are really excited that you are joining us. You may be asking if this is your first time or a returner, what is this All of Us program? So at this time, we're gonna share a very brief video that highlights the program.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. Here, we are fearless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. We ask America to do, once again, what she has always done. Lead the way forward. We're one nation, one people, but all of us are different, and it's those very differences that will lead to answers for generations to come.
So as you may have seen in the video, The All of Us Research Program is an effort to bring together 1 million or more volunteers that reflect the diversity of the people like ourselves living in the United States. The goal is that these 1 million or more volunteers will give their health data for at least 10 years. The program is open to people both healthy and sick from all communities. By attaining 1 million participants, the mission is to create a rich resource that will help researchers in their work to accelerate health research and medical breakthroughs, but best of all, enabling individualized prevention treatment and most importantly, care for all of us and for generations to come. So at this time, to share a little bit about tonight's program, I bring forth Brother Kenneth Barnes of Omega Psi Phi.
Thank you, Sorority Chambers, and good evening. I'm Frater Kenneth Barnes, the immediate past coordinator for the Omega Psi Phi fraternity for the BGLC, Black Greek Letter Consortium, and that's the Divine Nine in collaboration with the All of Us Research Program. Tonight, you're in for a treat. You are in for a great treat. We are proud to present Nurturing the Black Family in a Pandemic, Prenatal through Early Childhood webinar. The men of the Omega Psi Phi Fraternity Incorporated are proud and honored to partner with the lovely ladies, the sorors of Zeta Phi Beta Sorority Incorporated on this webinar. Now, why are we here? The primary purpose of this webinar is to provide each of you with an awareness of resources, tips, and strategies that you can utilize as you prepare for the arrival of your child or as you continue to raise your infant or toddler. This webinar will also provide specific information and/or action steps that will inform and educate moms and dads throughout this session. So without further ado, let me bring forth Soror Crystal Brown, who will introduce our panelists for the evening. Soror Brown.
Thank you, Brother Barnes. Good evening, everyone. I am Crystal R. Brown, Director for the All of Us program with Zeta Phi Beta Sorority Incorporated. We want to thank you for joining us tonight, and I would like to introduce our two lovely panelists for this evening. First, we have Dr. Tracy Weber. She was born and raised in Brooklyn, New York, graduating with a bachelor's in healthcare administration and a master's of public administration degrees from LIU Post. After working as a budgeting and contracting analyst, she decided to return to school for nursing, attending the Yale School of Nursing in 2007, and through the years completing a RN certification, MSN in midwifery, and a Doctor of Nursing practice. She has worked as a staff nurse on a mother-baby, antepartum high-risk obstetric and labor and delivery units, and a private practice as a midwife, as well as hospital-based midwifery services. Her career continued to expand throughout New York and the Poconos, becoming the first midwife to attend a birth at Pocono Medical Center, director of MCH Nursing at Wyckoff Hospital and Woodhull Medical Center, and director of MCH Nursing and Midwifery at Brookdale University Hospital and Medical Center. She currently serves as the director of the Midwifery Division at the University of Rochester Medical Center and is faculty in the Department of Obstetrics and Gynecology. She also serves on the boards of the Rochester Healthy Baby Network, the New York Midwives, and has been actively involved in activities related to eliminating racial disparities in women's and maternal health. She is a proud single mother of one. Dr. Weber was initiated into Zeta Phi Beta Sorority Incorporated on May 12, 2010 through the Eta Omicron Zeta chapter in Plainsville, New Jersey, and has since served in a plethora of leadership positions as she is transferred to other chapters. Following her, we will be hearing from Brother Robert Fairchild, who resides in Fairfax, Virginia. He has 3 children and is a retiree from the Xerox Corporation. He attended Lincoln University, Jefferson City, Missouri, where he earned his Bachelor's of Music Education degree from Lincoln and a Master's of Business Administration from Golden Gate University in San Francisco. Brother Fairchild is also a retired colonel in the United States Army. While on active duty, he served as an armor officer with tours in Germany, Vietnam, and various locations around the United States. While in Vietnam as an advisor to the Vietnamese Army unit, some of the medals he received were an Army Commendation Medal, 2 Bronze Stars of Valor, a Vietnamese Cross of Gallantry, and a Purple Heart. In addition to being a member of Greater Little Zion Baptist Church in Fairfax, Virginia, where he serves on the executive council and as minister of music, Brother Fairchild has been actively involved in his community leadership roles with a plethora of organizations, including the board of directors and charter member of the William P. Robertson Scholarship Foundation, president of Full Circle, an organization of business professionals, and the National Black Leadership Roundtable. Brother Fairchild is a life member of Omega Psi Phi Fraternity Incorporated, where he has held numerous positions at the chapter, district, and international level, the top position being the Grand Keeper of Records and Seal. He currently serves as the advisor to the fraternity's international president on fatherhood and mentoring. During his tenure as political action chairman, his efforts involved the fraternity in President Obama's fatherhood and mentoring initiative, which included interfacing with several congressional members at the White House. He served as the international chairman for the fraternity's Fatherhood and Mentoring Initiative, besides aggressively implementing the initiative in the 750 chapters around the world. He and his committee have planned and executed several forums on fatherhood and mentoring at the annual legislative conference of the Congressional Black Caucus. He also is currently working in coordination with the NPHC fraternities to facilitate a relationship with the Obama Foundation, promoting mentorship of young men under the My Brother's Keeper program. Ladies and gentlemen, I would like to present to you Dr. Tracy Weber and Brother Fairchild.
Thank you, Sora. Thank you for that beautiful introduction. I really appreciate that. Once again, my name is Dr. Tracy Weber. I'm a practicing midwife here in Rochester, New York. I'm currently working out of the University of Rochester Medical Center, and I work with the midwives there in the Department of OBGYN. And when the pandemic first struck here in about a little more than a year ago, we really had to rethink how we delivered prenatal care to our patients, because we wanted to create opportunities for our patients to obtain the same level of prenatal care that they always obtained pre-pandemic, but keeping mommies and babies safe, meaning safe from COVID, but also safe from adverse birth outcomes. So one of the things that we were able to do was to rethink how we delivered healthcare in terms of spacing of appointments. So I'm going to talk about that a little bit. We use telemedicine a lot more than we ever have, so I'll talk about that as well. And visitation policies in the hospital, doulas. So we're going to get into that in a little bit more detail. So the first thing I wanted to start off with was the concept of preconception counseling, because a lot of patients, by the time they come to see me in the office, they are already pregnant. But if anything, the pandemic taught people was planning their pregnancies a little bit closely, because there's so much more to consider during a pandemic when you're managing a pregnancy. Nearly half of all pregnancies in the United States are unattended. So when my patients come to me, I'd like to take a thorough history. First, I need to have some understanding if, it is an intended pregnancy, if it's a pregnancy that they plan to continue. But in addition to that, I try to weigh all risk factors in terms of their medical status, if they're at risk of having ectopic pregnancy, a miscarriage, or anything like that. However, before they're pregnant, It's really important to make sure that we understand if you have any of those risk factors, that you begin smoking cessation, you start reducing alcohol use. If you smoke marijuana, you might want to stop doing that as well, and start supplementing with folic acid, because that is something that really helps the development of a fetus. We like to go over your immunization status. So have you had your flu shot? Do you plan on getting a COVID vaccine, and how that factors into your decision and with regards to prenatal care? And I'll talk about that a little bit as well. Do you have any nutritional needs? What is your family history? Any genetic diseases in your family? Do you have someone that was born with a birth defect or with autism? Nutrition and weight counseling, screening for infectious diseases. So, for example, are you at an increased risk of herpes, or because that's something that also affects pregnancy? Or are you someone who, has a history of gonorrhea and chlamydia? So these are all the things that we want to screen for. And then the timing of your pregnancy and contraception. So did you just have a baby, within the last year? When do you think that you want to plan to have your next baby? What contraception do you want to use so that you can space out your pregnancies in a way that works best for you and your family? And then lastly, am I the right provider for you? Is our practice the right practice for you? Are you so high risk that you will not be appropriate for midwifery care? Or are you appropriate for midwifery care? So those are a lot of the things that we like to go over when you come in for preconception counseling. So in that first trimester of pregnancy, which is conception through 12 weeks and 6 days, once again, you come to see me. I want to know, okay, is this a pregnancy that you plan to continue, and look over risk factors, a complete medical history. So if you come to see me already, I just want to confirm that we have everything that we need all together. So if you're a patient who has a history of, poorly managed seizure disorder or out of control, diabetes, I could take care of you for your GYN care, but your pregnancy might be a little bit too high risk for a midwife or even an OBGYN to care for solo. We might have to consult with a high-risk OBGYN doctor, and that they're called maternal fetal medicine or perinatology. So we'll do a thorough physical exam, any prescriptions you need, whether it's prenatal vitamins or anti-nausea medication, we can provide that as well. Vaccination timing is something that we like to review. If it's flu season, we offer the flu season to everybody. The COVID vaccine, believe it or not, is safe during pregnancy. And one of the ways that we were able to figure that out is during the vaccine trials, a lot of the women who participated in the trials were unknowingly pregnant or became pregnant soon after they started the trials. And they went on to have very successful pregnancies. So now we're seeing more and more patients obtain the COVID vaccine, and or at least obtain the COVID vaccine immediately postpartum if they're nervous about obtaining it during pregnancy. The thing that I say to my patients who are kind of on a fence, they're not sure if they want to have the vaccine or not, is that pregnant women who develop COVID, it can go a number of ways, just like with everybody else. They could either have mild symptoms or moderate symptoms or no symptoms at all. And those are the COVID patients that we're the most nervous about, because they don't know that they have COVID and they continue to spread it. However, when pregnant women get sick, they're at an increased risk for severe illness, ICU admission, and intubation. And when they become really sick, it's our due diligence to save lives, right? So if you're intubated in the ICU, you're not improving, and you're 32 weeks pregnant, you will be delivered. So now you're intubated in ICU, you're severely compromised, and you have a preterm baby. So a lot of things to factor in. And a lot of times when I tell my patients that, they're like, oh, okay, they get it and they'll have the vaccine, but I leave the choice up to them. We also like to go over laboratory tests that are due in that first visit, and there's a lot of them. So everything from blood typing to checking for anemia, once again, screening for sexually transmitted infections, including bloodborne ones such as HIV, syphilis, hepatitis B, hepatitis C. So we go over all that. We'll obtain ultrasounds for dating and viability. And then we review, and this is where the COVID pandemic had us rethinking how we deliver prenatal care. We review telehealth versus in-office visits. So there are certain points in the pregnancy that we would really like to see patients in the office. Like, for example, on the day that you're having your 20-week ultrasound, that's when we look at the baby's full anatomy. We'd like to touch base with you at that point. However, if you're coming to see me at 12 weeks and your next appointment is at 16 weeks, if all I'm doing is a little quick belly check, you can make that a telemedicine appointment. If you're coming to see me at 30 weeks, if your baby is moving and you're feeling well, you can make that a telemedicine appointment. Not all appointments need to be in the office. We have some patients who are like, absolutely not, I need to be seen in the office for all of my prenatal visits because I feel comfortable because my anxiety is on high. Perfect. We have patients who say, absolutely not, I will see you when I'm ready to have this baby, and I'll come to see you at certain milestones in my pregnancy, but I need to have all of my prenatal visits, the majority of them, at home, and we'll do telemedicine. Perfect. So those are the things that we'll review with you at that first appointment to just basically gauge where you are. And we also want to discuss with our patients any policies with regards to expectations, especially when it comes to the hospital. When to come to the hospital, when to call, going to the emergency room versus going to labor and delivery, and at what point in your pregnancy would you do either? And then also reviewing some of the guidelines in the hospital with regard to COVID, because in the beginning of the pandemic, there were certain hospitals in certain cities where the pandemic was really raging, where patients were coming to the hospital to have their babies by themselves. That created a lot of anxiety. We also had patients that were considering not coming to the hospital at all. They were thinking about home birth. They were thinking about unassisted home birth, meaning mom, dad, and that's it. No licensed medical provider, which scared me a little bit because, how do you manage complications if you're not a trained individual? Some patients were looking at birth centers, and home birth and birth centers are definitely viable options. But if your choice is, you know what, I want to deliver in hospital, or if your pregnancy puts you at an increased risk where a birth center or home birth is not an option for you, then it's important for you to understand what having a baby in a hospital during the COVID pandemic means. So what are the visitation policies? Can my husband be there? Can I have a doula in the hospital with me? After I have the baby, who can come visit? Are there certain time limits for visitation? Will I be required to be COVID tested upon admission? If my baby's admitted to the NICU and I'm not COVID tested, what does that mean? So these are some of the things that you want to establish early on in your pregnancy. In that second trimester of pregnancy, which is week 13 to 1 day shy of week 28, we'll review any additional genetic testing that you may require. And the genetic testing that we currently offer, there's a first trimester screen where we look at risk factors for having a baby with Down syndrome. There's trisomy 18. There's something called spinal muscular atrophy. There's cystic fibrosis screening. There's screening for sickle diseases or what we call hemoglobinopathies. So we try to look at all of that. At about 20 weeks, that's when you have that anatomy scan. So we look at baby from head to toe, looking at different organ systems, measurements, amniotic fluid measurements, looking at the baby's growth. At about 28 weeks, we screen for gestational diabetes, and we also check again for anemia at that point. If your blood type is Rh negative, we will add an additional lab and then give you a RhoGAM shot, which protects you against having miscarriages in future pregnancies. And we offer the Tdap vaccine. Now, in terms of vaccines, and this is true for GYN patients as well. So like, let's say you receive a vaccine for Tdap, or you're not pregnant and you receive a vaccine for Gardasil, which is the HPV vaccine. Just be cognizant of the fact that if you do plan to get the COVID vaccine, you must face it 2 weeks apart. So you cannot have a COVID vaccine within 2 weeks of another vaccine, flu vaccine, any other vaccines that you may receive. We also want to start talking to our patients about post-pregnancy contraception. So after you have this baby, what is your plan for contraception? Do you want to do natural family planning? Are you planning to have a tubal? Because if you're planning to have your tubes tied, then we need to go through the consent form, the surgical procedure, We'll have you speak to one of our doctors if that's necessary. And then that way, when you deliver your baby, you can have your tubal the very next day. Do you plan on going on birth control pills? Do you plan on having an IUD? When do you want to time that? What would be the best birth control pill for you if you're breastfeeding and that type of thing? We also ask you to start looking at your pediatrician because you don't want to wait until the last minute and then scramble to find a pediatrician. And then selecting your doula. And a doula is somebody who is trained in childbirth support. And there's different types of doulas. You have doulas who will be with you up until you have your baby, and then also doulas who are postpartum. So you want to be careful about, you don't want to hire a postpartum doula only to find out that she doesn't provide labor support. And then we have doulas who do some of everything. So in that third trimester of pregnancy, all the way through childbirth, we start talking about childbirth education and things you need to do to prepare your baby to come home. Here in New York State, where I reside, moms are, their insurance will cover a breast pump. So all you need is a prescription. And you can get a pretty decent breast pump. All you need is a prescription from your provider. We start talking about any indications for induction of labor. So for example, if the baby is not growing very well, sometimes we might decide to induce a little bit earlier. Or if you're past your due date, such as I was, so when I was having my baby, I was over, 10, 11 days over my due date, I was an induction for that particular reason. But also if someone has blood pressure issues or their diabetes is poorly managed or anything under the sun, then we can start talking about indications for induction of labor. Along those same lines, indication for C-sections. So if this is a patient who has had more than 2 C-sections in the past, then chances are she will have a repeat C-section, or if the baby is malpositioned. So if your baby is breech, instead of head down, they can try and turn your baby, but for the most part, if the baby will not turn for any particular reason, or if the mom has had any other uterine surgeries, then there might be an indication for a C-section. We'll talk about COVID testing and the requirements for that upon admission, hospital hours, visitation, employment considerations. So how long are you going to stay out of work and what paperwork do you need to complete in order to do that? And then also you have to start planning ahead for childcare. So who is going to be helping you take care of this baby after you return to work? So when it comes to all these different visits for every trimester, some of these appointments are more require like an exam, and some of these appointments require more of a conversation. And we tell our patients, you don't have to come to the office. As long as you can feel your baby moving and you're feeling well, then that's great. You can get a blood pressure cuff. You can monitor your blood pressure at home. When you log onto the Zoom call for your appointment, tell me what your blood pressure is. Tell me how you're feeling. What's going on today? Have you had anything to eat? How are you drinking? What are your questions and concerns? Do you need any prescriptions? Like, these are all of the things that we talk about. We do so much teaching in our appointments. Even if it's their second, third, or fourth baby, there's still a lot of teaching involved. So if a patient feels more comfortable staying at home and having a telemedicine appointment, that's totally fine. So when we think about pregnancy, we always talk about the first, the second, and the third trimester, but there's actually a fourth trimester, and that's from childbirth through the first 6 weeks. So that's when moms who are breastfeeding will require some breastfeeding support, especially first-time moms. And there are some babies, for moms who are not having their babies for the first time, that have difficulties latching on for a variety of different reasons. So we do provide breastfeeding support. Here where I work, we have a department of breastfeeding medicine, and they are pediatricians and lactation consultants who are very supportive of our patients. We also talk about care providers. So who's going to be helping you at home care for this baby? Is it going to be you and your husband? Are grandparents going to be involved? I don't know if you remember, but in a prior slide, I talked about the Tdap vaccine, and that's tetanus, diphtheria, and pertussis. We give that to our patients at about the 28th week of pregnancy. However, the part of the vaccine that we're most concerned about is the pertussis part, and that's whooping cough, because our babies are not born protected against that, and they cannot obtain that vaccine right away. That being said, if a baby is exposed to and develops whooping cough in infancy, it can be deadly. So we don't require, we advocate for moms to be vaccinated against the pertussis, which is a Tdap vaccine, at around the 28th week. But we also ask that they recommend that their care providers be vaccinated. So anyone who's going to be caring for that baby, dad, grandma, grandpa, auntie, babysitter, they should also receive that vaccine. The one thing that I didn't mention about the Tdap vaccine is that it has to be given every pregnancy. So if you're pregnant every year for the next 5 years, you will get that vaccine every single year. And that's only because you pass on those antibodies to the developing baby. It's also important to think about visitors at home, okay? So it's a little bit easier now because we have the COVID vaccine. So, now the restrictions for vaccinated people converging all together without a mask on, the restrictions are a little bit less. However, what are you gonna do if you have a member of your family who's not COVID vaccinated and they want to come visit the baby? Like, these are all the things that you have to think about during this pandemic. Your 6-week postpartum exam. When I deliver babies, I usually have them come back in 5 weeks. However, in case they miss that appointment, and they can come in the 6th week and make that 6-week mark. However, my issue with waiting until 6 weeks as well is that there are certain patients who need support. And I hate to say, okay, you had your baby, here's your baby, good luck, and I'll see you in 6 weeks. And then there's this gap of care. So if I think that I have a patient who's at increased risk for postpartum depression, who has blood pressure issues, who had surgery postpartum, who had excessive bleeding postpartum, any concerns at all, I might see them in a week. I might check in with them in a week and just say, hey, how you doing? How's your bleeding? How are your moods? Let's check your blood pressure and that type of thing, because I don't want anyone to get lost to care. And truth be told, a lot of our patients do not come back for that 6-week visit. So, I don't want to see them a year from now and then learn that there were some issues that weren't addressed in that first 6 weeks. We also talk about contraception at that particular time and have discussions about when to return to work. So the one thing that's really important to make note of is that for that postpartum exam, some of our patients are opting to do that via telemedicine. There's a lot of education that happens in that exam. And as long as they feel well, meaning that their pain is well managed, they're not overly, depressed or going through, mood swings that are concerning, their bleeding is well managed, they're breastfeeding well, there's no reason for them to come in for an exam. So we can do that all via telemedicine, or, they can come into the office for an exam as well. So these are the things that changed during the pandemic in terms of how we deliver prenatal care, whether patients are coming to the office to be examined or they have the telemedicine appointment. And it has been very, very successful.
Dr. Weber, that was so informative. And on behalf of any expectant mom that may be here, any expectant dad, I know they learned something new. And before we turn it over to Brother Fairchild, who's going to speak to the brothers, especially to support that prenatal, we did just want to talk about 2 quick topics for those toddlers in the pandemic. So the first thing is just social skills. And what we just want to recommend is that even though, yes, we're practicing social distancing, it's very vital that for our toddlers, we're still helping them with social emotional skills. And so just some quick tips. Anytime you have the opportunity to practice how to share throughout the day, yes, whether it's lunch, that snack. The other piece that we often neglect is simple language. So anytime that you can say to that young child, 1 to 3, or even as young as 6 to 9 months, is it my turn? I want to play. Can we share? This last tip we want to stress, very important. A lot of our young children are often in the house with a lot of adults. And one area that educators of those 0 to 3 is self-regulation. And so you want to, as the amazing caregiver in the home, practice getting frustrated and calming yourself down. So when you speak to those preschool experts, they're telling you kids still are coming, they know how to share in the pandemic, but that self-regulation, we want to make sure we're practicing that at home. Okay, it starts at 1 because terrible 2 will become even more terrible at 3 if they're not learning how to self-regulate. The last thing that we also wanted to share, we all understand we're Zoom fatigue, Google Meet, name it. However, screen time, we're not saying do not give the phones and the tablets, because what the research is telling us is that video chat, even for those young children, one, is helping them build relationship. You'll be surprised at the young babies that hear a voice on the screen, and then as they get older, you're like, wow, how do you know me? Why are you reaching? It's through that video chat. We're stressed. We're in a pandemic. So if you're going to give the phone, you're going to give that iPad, that computer, or whatever device, choose educational program. Anytime they have the screen, whether it's a sing-along, whether it's something that's teaching them their colors, kids just want to be engaged. Also, you can watch these programs with the toddlers. Allow them to tell you, what did we just watch? What did we see? Do pretend play. And if you don't remember anything else about our young toddler friends, they have to have a balanced activity diet, not food. That's important. That's a different presentation, but activity diet. If they're on the screen 3 hours, how much time are they doing free play, story, book time, running around? You don't want them to become so dependent upon the screen that when they do return to those amazing sensors that are geared for them, they just want to sit. This is where their minds are growing, and that playtime and allowing them to be creative, not just with the screen, is really, really important. So at this time, I'm so excited to hear about how our amazing men can help us navigate nurturing the Black family in this pandemic.
I'm smiling because you gave half my presentation. That's a very good presentation, the information you shared. The impact of fathers in those particular areas it's kind of interesting. From our fraternity point of view, we focus on a little older, 5, 6, 7, 8, 0 up till they're coming out of college. But we also focus on the fathers. And so the fathers have to be involved at that early age, at the beginning, at the very beginning. It's really, really important. And she mentioned the positive social, emotional involvement, that playful thought process. Fathers playing with their kids helps to develop that, helps them to build self-confidence. And the important thing that when we look at, especially toddlers, a lot of times they are actively involved in a lot of ways, and they're looking for something to do and someone to play with. It's okay for a father to get involved in that. What that does, it gives the youngster confidence in what they can get done and how they will proceed forward in the future. When we start talking about developing and as we start moving to school, higher school, kids who are working with their fathers have a tendency to be better prepared to start into school. They're more organized, they're more disciplined, they can take a greater approach to getting things done. And because they're more organized in the way they approach it. And it's simply because of the father's involvement. When we look at fathers involved in education, they do better in school. They have a tendency even to go on later on and graduate. One of the things we run into a lot on the other side of the fence is trying to catch young men who decide to give up, quit, because they don't have the confidence to believe that they will be worth anything. But when fathers are involved in that early age, those are formative years. When they're involved in those early years, the kids have that I can do itiveness. I can make things happen because they've had the opportunity. Plus, on top of that, they can see an example of a father. The male figure provides a certain amount of confidence for them to be successful in what they're trying to accomplish and what they're trying to do. The children even start speaking earlier. There's been a lot of research on all these things I'm talking about that have shown the positive results of father's involvement. Father's involvement are really key to the mental development of a kid. You know, the whole thought process, even when we started a long time ago, working with this whole father and mentoring effort with the Obama administration, the idea was to balance it out. So we had fathers and mothers involved, even if the father and mother did not get along, but they were working for the benefit of the kid. And that's important because kids need that balance as they move forward, because they're looking at examples. The examples mean a lot to them. They see an example of a male figure. They see an example of a female figure. From a female point of view, they see the compassionate side. From the father side, you see the stern side. That male. How do you say the? I'm losing thought process. In other words, it's a kind of person who has that can-do-itiveness thought process, and they feel success. I can do this, rather than I'm not. I don't have the confidence to get it done. I don't have. That's important for a kid to develop, especially if they start to get engaged with their peers. A lot of times, kids can grow up and tend to sometimes be a little bullies. But when kids have confidence, that the bully stuff doesn't bother them. But that can be and still become from working with a father. So it's important that be laid out there. One thing also with a male child, it's really important that certain relationships are established that help them understand that there's consequence for everything you do, good and bad. Even when you are 2 or 3 years old, you want to instill that right and wrong thought process. And fathers have a tendency to cause that to happen more so because they're more disciplinary in addressing the situation, so that as that kid grows up now, they're more likely not to get in trouble. And that's a key factor in a lot of kids' development, being successful in life later on. One of the things that we look at when we're mentoring, we pick up kids, like I say, when they're in their say 7, 8, 9, 10 area. But we look at fathers who have to start off when they're 16 and 17 years old. And you got to understand that there's the mental development of a father at that particular time. Our efforts are to help lead and guide that young father through the difficult times of trying to be a man, because he's not a man yet. And so as a result of that, all the things I'm talking to you about, we try to help them understand the importance of why you need to be doing these things and what the impact of that kid. Sometimes I think people have kids and don't think about the fact that I got to raise this kid. They just bring the kid into the world and let the kid exist. And the sad thing about it, this little device right here becomes the enemy, because they spend a lot of time on this thing. And as long as they're quiet, mom and daddy's okay. That's not good. In fact, it's been recommended, and I know it's a tough thing to say for a lot of kids, but it's recommended that electronic devices should not be no more than 2 hours in a kid's life. Okay? Watching television, on the telephone, playing games, no more than 2 hours a day. And so it's something that, from a disciplinary point of view, you want to also, not disciplinary, from a health point of view, you also want the kid to learn to play outside. And so fathers can be out there with the kids, play with them outside, help them feel comfortable about being outside, rather than I'm sitting in front of a screen, playing a game all day long, and not really doing anything with developing my mind. Last point I'll make, because I don't want to run over our time here, is this whole thing about what it takes to get things done. A lot of times kids have a tendency to grow up without having the thought process, I have to work for this. So even at a very early age, it's okay to learn that if you do this, this equals this. And you teach a kid a lot of those traits as they are in the early ages, And like I say, when they grow up, they don't forget it. They tend to grow up with it. They see the confidence. They see the results of doing good, positive things. I always was told for every action, there's a consequence. And so it's very important that you instill that early in a kid's life. So as they grow up, they will grow up on a positive side. And so you don't meet them at the jailhouse. Okay. There's a lot more I'd like to talk about, but I don't want to run over time. I know we're kind of tight on time. So those are the points I have. And if there are any questions out there, I'd be glad to answer anything. So I'd like to turn this over to Brother Earl Wilson. He's got some questions, I guess, right?
Yeah, thank you, Dr. Weber, and also thank you, Brother Fairchild, for this outstanding information, for the wealth of information that you passed on to our audience. I have several questions for you all, which should enlighten our audience. So one of the questions is, how can parents, grandparents, spouses, and or new fathers protect the new parent mental health during this COVID-19 breakout? And what are some of the resources that are available to help with their mental health for both parents?
Sister Weber?
Yeah, so for our moms, we basically say, like when I counsel my patients about postpartum depression, especially, and it can be really difficult right now because moms are so isolated. So normally we have visitors come to the house and people are bringing food and, gifts and just visiting you so that you're not lonely and giving you some extra support so you can go take a shower, right? So someone is going to come and watch the baby for a couple of hours so that you can go on a date with your husband or whatever. That's not a thing anymore. And I think parents are feeling really isolated. So I tell my moms all the time, if you're starting to feel a little overwhelmed, please reach out to me so that I can get you the help that you need, whether if it's, and a lot of services that we're offering for mental health are done via telemedicine too. So it's really difficult to hustle to an appointment to see a psychotherapist if you have a, 3-week-old baby that you have to tow around, right? And there are certain practices that are not even letting babies in the office, but you can get that telemedicine appointment as well. So you don't have to feel like you're completely abandoned. I would say reach out to the person who delivered you. There's also all types of 800 numbers for mental health crisis outlines and that type of thing. So, even if I can't get to my patient right away, I just had a situation over the weekend with a patient that was kind of spiraling into a dark place. So, I was able to get in touch with her and, get her the help that she needs by reaching back out to people in my office and making sure that she gets a follow-up appointment so that we can get her some help, because she has a long history of depression and just had a baby about 3 weeks ago and was in a very dark place. So, but the first thing you want to do is reach out to the provider who delivered you. And then as a provider, if I have a patient who has a history of depression, I need to know about that, because maybe they need to start on antidepressive medicine before they even have their baby, so that by the time that the baby comes, they're not feeling so overwhelmed. Or I need to have some discussions with the father just to make sure that he's aware. She has this history of depression. So if you start noticing something, please, if she can't call, then you need to call me. And I've had that happen to me too. I had a patient with suicidal ideation, and it was her husband who called me. It wasn't her. And that was really helpful. And we were able to get her the help that she needed right away.
Okay.
And let me add something. In our efforts we have a program called Brother, You On My Mind. The whole thought process about depression, mental health issues, especially for young fathers. We try to help the father to understand what that postpartum scenario is all about, and that they don't get depressed, because that doesn't help the mother. So it helps to just, sometimes it's making them aware of what the situation is, and now they can help the situation versus hurt it, is really important. Fathers need to understand it. So one of the things we try to do is try to provide information about all aspects so that you know how to deal with it, so we can get away from the depression thought process, because that doesn't help any situation at all.
Right. And Brother Fairchild, I'd like to ask, in my style of practice, first of all, I love it when the fathers come to the prenatal appointments. I answer everybody's questions. Before they walk out the door, I ask the father if he has any questions and concerns, because I'm treating a family unit. I'm not just taking care of the mom and the baby. I'm taking care of him as well, because he's important. I like the dads to be involved in the delivery. I have assisted dads delivering their own babies. So I put gloves on his hands too, and we deliver that baby together. I want to make sure that, hey, are you going to cut the cord, or do you want me to cut the cord? Like, I want them to be involved every step of the way. And I think, oh, and also when they come to see me for those prenatal appointments, you know, when they measure the belly and then you put the little machine on, it's called a Doppler, and you check the baby's heartbeat. I teach the dads how to do that part, and they do it. So I measure the belly and I hand them the little machine, and they check the baby's heartbeat, and then they tell me what the number is. So like, it's really important for me to incorporate the dads into the visit. And I think that really helps the whole bonding process after the baby is born.
And I will add to this, as a father who went through exactly what you just said with all my kids, you're exactly right. It puts you a lot closer to the wife and the mother, and it puts the whole. I mean, you have a different perspective on life when you're involved in the birth of your kids. So it's a very good thing.
Yeah.
Okay. Great answers. And that kind of led into my second question a little bit about where dads matter. We have subjects during our fatherhood initiative that both parents matter. And you've touched on it a little bit, but what are some of the resources that are available for those fathers who are very fearful about being included in there? And how can they reach out to those various organizations or resources that are available to get them more confident in being a part of the prenatal process?
Well, there are a lot of organizations out, fatherhood organizations out that are very helpful. And of course, our fraternity. I mean, we do a lot of this where we try to coach fathers. Our real heavy target is a 16 to 24-year-old, because they're the ones that seem to have the most problems. And they're the ones that seem to go off course real quick and get frustrated, and then tend to do some things that are not productive to the relationship. And so we try to coach them, we try to explain, and we try to also, in many cases, we try to tag them up with fathers who are a little bit older, who have gone through the process, so they're speaking with somebody who's got experience and understand what the situation is and can help them. So at least they're not talking about somebody who's talking theory, they're talking about somebody who's actually lived through it. So that's very important. Those are resources, I think, that's right in our backyard. So all we gotta do is reach out for them.
I think it's really important, Brother Fairchild, you really hit the nail on the head to have that peer involvement with an older dad who's gone through it all, because some of these young brothers, they haven't had a father figure in their lives, so they don't have anything to model it on. So just connecting them to that peer is really important. I'm originally from New York City. I'm a Brooklyn girl. So in the New York City Department of Health and Mental Hygiene, they do have some fatherhood initiatives throughout the 5 boroughs. And then here, I work with the Healthy Baby Network, which is an organization where they have different initiatives for healthy mommies and babies, but they also have a fatherhood initiative as well.
Yeah, I'll also add one more. In fact, National Healthy Start has cranked up their fatherhood thing. They've really stepped up on that. They recognize that fathers are important, so they're really stepping up to it too. So that's another resource.
All right. Last question from me, and I asked the participant, make sure you go in the Q&A, put your questions in. How can organizations like NPAC, the National Prenatal Council, become allies to provide resources and funds to support families during this pandemic?
That's a good one.
How can...
I can't speak for everybody else's work.
Well, speak for yours.
So
how can your organization become an ally?
Zeta Phi Beta Sorority Incorporated has always been allied with the March of Dimes. So we have a lot of initiatives with regard to healthy babies in terms of making sure that moms not only obtain prenatal care, but to prevent or obtain, I will say, adequate prenatal care, but to prevent preterm birth. We have our Stork's Nest project, which at the current moment is virtual. Okay, so Stork's Nest usually involved in-person group sessions, and now, because of the pandemic, our program is completely virtual, where our mommies who participate in the program complete certain modules on an app, and then they're able to receive rewards for obtaining prenatal care and completing the modules. So that's something that our sorority has been doing, which is really, really significant. Another initiative that we have is with regards to domestic violence. And although you're thinking, okay, domestic violence, prenatal care, but I will tell you, during pregnancy, domestic violence, if it's present, or even if it isn't present, it tends to escalate during pregnancy for a lot of our patients. And then tie into that a pandemic where people are feeling isolated, people are having financial issues because they're not working as much or they completely lost their job, and you know, somebody has a mental health history. The pandemic can be really triggering for them. So if you factor in the pandemic and, you know, other stresses related to the pregnancy, domestic violence can be pretty much escalated during pregnancy. And our sorority has done a lot in the last year in terms of domestic violence awareness. So right now, we're looking at advocacy and working with local politicians to basically push forward policy and legislation with regards to domestic violence. We've done initiatives with shelters, and getting back to prenatal care, we have 2 initiatives with regard to birth equity, because a lot of families don't have food or they don't have transportation. So we have a twofold initiative where chapters in our organization can select one, if not both, of the initiatives to either help provide food services through a food bank for a family, or vouchers for transportation for families so that they can get to and from their prenatal appointments.
Yeah, in our fatherhood and mentoring effort, we address all aspects of a problem that a father would face: mental health, domestic violence. We get in fact, we partner with a lot of organizations. There's a group called CSOSA, who fathering courts. There's all kind of areas that we join in partnership with several organizations. We've even partnered with domestic violence organization. There's one organization called Futures Without Violence. We partner with, and to address in specific domestic violence. And it's one of those kind of things where, again, you probably see it when I say the 16 to 24. You probably see it more in the younger, because they get frustrated quicker. You get post PTSD. You get all kind of strange things coming out of somebody's mind trying to deal with the problems, trying to survive. The pandemic has certainly presented a lot of people with problems economically, so the frustration is high. So anything we can do to help address that, we pretty much get involved. But the fatherhood and mentoring effort has really made a big difference in a lot of ways.
Okay, those are my 3 questions. Do we have any in the question and answer section from our participants?
I do not see any. So if there are any questions that anyone would like to ask our panelists, now would be a great time to do so. You could also feel free to email either of the coordinators this evening if you come up with a question later. But if there are no other questions, I'm going to turn it over to Dr. Chambers Williams to close us out.
All right, so I hope everyone has walked away with even one tip. I have at least 5 about nurturing the Black family in the pandemic, and there's a lot of resources, so please reach out to the organizations in your local chapters as well. And so to close us out, I wanted to just share a little bit about, for those that maybe you've been here before and you're like, you know what, I've been hearing a lot about the All of Us, and I think I'm ready to take the next step. And so on this screen, what we have here are the different market cities that the program already has HPOs. These are the organizations that do the enrollment. So on the next 3 slides, I have 3 market cities that if you are a resident or you live near Atlanta, Georgia, Detroit, Michigan, or New York, New York. We've heard a lot about New York tonight. We encourage you to take a picture of these market cities. In the chat, we also have placed the post survey. This is really important data for us as well. So we encourage you to take that. So as I mentioned, if you are in that Atlanta, Georgia area, there are 3 different HPOs that if you want to learn more about enrollment, what are the next steps? We have the Morehouse School of Medicine, Emory University, as well as the Veterans Affairs. So we'll leave that up for about 30 seconds. And if you have family in this area, please also feel free to take a picture and share with them. Next up, as I mentioned before, another target city is Detroit, Michigan. So on here, you'll notice there's an actual engagement coordinator here. They have an app, so if you want to scan it, you can. But we really want to make sure that as the program grows, more people who look like us become a part of that database. We need it. You heard a lot of statistics today. We want to make sure that generations to come have access to the right preventive care to prevent all those statistics that we hear about with our community. Last, but certainly not least, if you are in the tri-state near New York City, there are 3 locations listed here: Columbia Medical Center, Harlem Hospital, as well as Winnell Cornell Medicine. And so both Zeta Phi Beta Sorority Incorporated and Omega Psi Phi, along with the rest of Divine Nine, we are committed to spreading awareness about the All of Us research program because we need to be a part of this program. So without further ado, I will put the survey again in the chat. This is a post survey, so we ask that you please take a moment and fill it out. And we hope to see you at a future event. Have a great and blessed night.